Hi, everybody. Welcome to today's in-service. The topic of today's in-service is networking for referral and follow-up procedures. So our objectives today are to identify 3 situations when an occupational therapist would refer clients to other professions or specialists, identify 4 professions that an occupational therapist would refer a client to, identify 3 follow-up procedures done in occupational therapy settings. So first, we're going to discuss what a referral is. So this information is back in your brain from Foundations with Dr. Lancaster. So it's only fair that since we learned this information first in Dr. Lancaster's class, that we do some retrieval practice. So if everybody will take out a sheet of paper and a pen, or you can type it on your computer, and write down what you think a referral is and how an OT might receive a referral. So I'll give you guys a little bit of time to do this retrieval practice, and I will do it with you. Okay, you can go. Thank you guys so much for doing that. I hope you all enjoyed thinking back to our time in Foundations. So the information I'm about to share with you, I got from our Foundations textbook, Introduction to Occupational Therapy. And so this book states that a referral is how the OT process begins. A referral is a request for service. So referrals can range from a specific order, such as dynamic orthosis, or it can be a general referral, which would be OT to evaluate and treat. But regulations and third-party payer policies determine the type of referral that is required, like if a physician order is needed. For example, Medicare requires that all services be certified by an MD or an NPP, and an NPP is a non-physician practitioner, and it does not allow chiropractors or dentists to order therapy. So as I was preparing for this in-service presentation, I reached out to talk with an alum of our program, and I also reached out to 2 occupational therapists to gather information on referrals and follow-up procedures. I also read in our same textbook, the Documenting Occupational Therapy Practice textbook. So according to this textbook, OTs can receive referrals from almost anyone. There is no national rules or regulations that prevent or state that an OT can't receive a referral from anyone. So for example, the documentation textbook states that a teacher, a nurse, a physical therapist, a dentist can all make a referral for OT services. But like I mentioned before, third-party payers will often not pay for therapy services with just a referral unless that referral comes from a physician. Also, state licensure laws can also say whether or not referrals are required and who can write a referral. So, AOTA has standards for referrals under the Standards of Practice for Occupational Therapy on the AOTA website. So these standards state that OTs are responsible for receiving and responding to referrals. So the standards state and require that OTs refer clients to other practitioners when the client needs a provider with expertise in an area that the OT cannot provide. So the standard I just mentioned, it doesn't include just referring clients to specialty OTs, but it also includes and requires OTs to refer a client to another profession if that's needed. So now we'll move on and we'll discuss professions that OT would refer a client to. So we're going to do a little bit more retrieval practice, and I want everybody to, on the same sheet of paper, to think and write down 3 or 4 professions that you think an OT would refer a client to. I'll give you guys a few seconds to do that, and you can begin. Okay, so thank you guys so much for doing the retrieval practice with me. So one of the more popular professions is physical therapy. So you could refer a client to physical therapy if you've seen mobility challenges, significant lower extremity weakness, endurance deficits, or input for wheelchair or mobility device input. Another common one is a speech therapist. For swallowing or aspiration, you might refer to a speech language pathologist. So social workers also can be referred out if abuse or neglect is suspected in a client, then you might want to contact the social worker. Psychiatrists also are a common one if you're seeing mental health concerns. When I was speaking to an alum, she stated that a physical therapist and a psychiatrist were the two most common referrals she saw whenever she was on level 2 fieldwork at Vanderbilt and at Madonna. Also, a dietitian would be a good referral source if the OT is suspecting weight loss or a lot of fatigue in the client, or you're not thinking they get the nutrition that they need in order to have a successful recovery. Another profession would be an adaptive equipment specialist or an orthotic specialist. So one profession that you could refer a client to is their physician. If a client is not responding to therapy, then the OT could recommend that the client go back and see their doctor. Or if the therapist sees that the client isn't progressing as he or she should be or is expected to be, then the doctor might need to take another look at the client. Or if the therapist sees something that the doctor needs to take a look at, that might be a reason for therapy needing to be stopped, then the therapist can send the client back to the doctor to get assessed further before continuing with therapy services. So there are many professions that OT might refer a client to. It could be an eye doctor, a wound care specialist, and so on, many more. So as we know, occupational therapy is a client-centered profession. So the referrals that you're going to make for the client will be client-centered as well. It's also important to note here that a referral should be done as soon as something is detected, because as we know, getting therapy or getting treatment early on can help improve outcomes. So some major reasons that an OT might refer a client is when the client is not showing signs of improvement, or new medical history about the client is discovered, if the client has a significant change in status, a significant fall, or a surgery. Also, if a new condition arises. If the client needs treatment outside of the treating OT's expertise, then that would be a major reason that an OT would refer out. So if a client needs assistance in another specific medical field, such as a neurologist, a psychologist, a physical therapist, then the OT should refer the client to that other profession as soon as possible. So I spoke with a therapist who worked in the school system. She works in the school system currently, and she discussed her referral process with me in the school system. So if she's treating a student and she sees mobility problems and she thinks, I think the child would benefit from physical therapy, then the therapist would talk to the student's parents and make sure that parents are okay with potentially seeking physical therapy services. And then the therapist would go and talk to the teacher. And typically the teacher says, yes, I've seen those problems too. I've also noticed what you're noticing in therapy. So then the teacher would fill out what's called a screen form. And the screen form has a problems list. And the teacher would write, falls a lot on the playground, hard time going up the stairs, and that problem list and the screen form would go to the physical therapist. I also spoke with another occupational therapist, and this OT has worked in a pediatric outpatient clinic as well as in a nursing home. And whenever he was in the pediatric outpatient clinic, if he saw that a child might need another profession or might need to see a specialist, the first step was mentioning this information and his observations and what he saw to the parents of the child. And then he would offer the parents, say, I can contact your doctor directly if you want me to, and get the parents' approval for that. Whenever he was working in a nursing home and he saw a client need another profession or need a specialist, then he would discuss that information in a family meeting or with a family member. And then if the family was okay with starting a referral process, then the OT would meet with the medical director on staff at the nursing home. Okay, so we have talked about referrals and we are going to talk about follow-up procedures now. So I want to take about 30 seconds and I want us all to think about a couple of ways that an OT clinic or a hospital or any setting would follow up with a client after discharge. So we're going to take a few seconds and we're going to write down our brainstorming for follow-up procedures. Okay, you can start. Okay, thank you guys for doing that. So, some ways a client would be a part of a follow-up procedure would be having an appointment with their doctor. So, after therapy is finished and the client has been discharged, the client would go see their doctor for a follow-up appointment. Another way in a clinic or setting would be the clinic might call the client and do a follow-up or do a quick check-in. Another way a follow-up procedure might be done in a setting is if the case manager fulfills that role. So whenever I spoke with the alum from our program, she said that whenever she was on fieldwork at Vanderbilt, the practitioners did not follow up, but the case managers were the ones that followed up and then sometimes were to report back to the occupational therapist. So the same therapist I spoke with, who currently works in the school system, she said that a student before a student is completely discharged, they go into what's called a consultation period. So the student goes from the direct service model to a consultation level and then is discharged. And in that consultation period, that can serve as kind of the follow-up period, because if the student or the teacher or the parent needs something from the therapist, then they can always communicate with them in the consultation period, but as well post-discharge, the therapist always allows open communication if a problem arises. So all settings do different follow-up procedures, and there's not a standard protocol across the board. So you can, wherever you go, there might be a different follow-up procedure done. So that's all I have for you guys. Thank you so much. And the objectives that we met today were to identify 3 situations when an occupational therapist would refer clients to other professions or specialists. We discussed when an OT would refer a client to another profession and also how an OT receives referrals. Our second objective was to identify 4 professions that an occupational therapist would refer clients to. We talked about many different professions and different times when professions would be needed to be included in client care. The third objective we met was to identify 3 follow-up procedures done in occupational therapy settings. And we talked about many examples of follow-up procedures and how there's not one across the board. So I hope you all learned something new today. I hope you reviewed something that you already knew. And I just want to thank you so much again for listening to my in-service video. And there's a Google Forms link that I would like you guys to fill out as soon as you can for me. So thank you guys so much again for listening.